78 people, I've seen 121 back so far, or I've followed up 121, I should say. So I'm about 3/4 of the way through things. So far, 86 of the 178 have come back to have all the assessments done and MRI scans. There's 34 people who haven't come back, and some people have just said no. You know, life's busy, I've got kids. You know, it's not convenient, which is understandable. It's a big commitment. It's a whole day out of your life coming to take part in the research. There's 7 people who are living abroad, and I've been able to follow them up on the telephone and via Skype, and get a picture of you know, what's happened to them, what their disease course has been, how they're affected by MS. Unfortunately, there's some people who are deceased for one reason or another, and some people who are just too disabled to come for a 2-hour MRI scan to make the trip into central London as well. There's only one person so far out of the 121 that's hung up the phone on me, with another comment before that. Which I think is pretty remarkable. And the strength of our results really depend on finding out what's happened to every one of those 178 people. And we're on track, actually, at the moment to get more than 95% of those people to find out how they are after all these years. And this is just a bit of a picture about what's happened to them. So pretty much what I was saying before, that of the people who had a first attack 15 years ago, about a quarter haven't had anything else happen. Okay, they've stayed what we call a clinically isolated syndrome. And about 75% have gone on to develop MS. And in the majority of these people, the MS is still relapsing and remitting, but 21 have developed secondary progressive MS. There are 2 people in the study who had optic neuritis, and actually they don't have MS. They've got a related condition called neuromyelitis optica, which is sort of the first cousin of MS, and can confuse us when we're first seeing people. Now, this is how everybody looks, and after all this time, and this is this EDSS score, where 0 means that they're neurologically normal. So even Dr. Willoughby wouldn't be able to find any problem with them on examination, although I might miss 1 or 2 things maybe, but he's pretty sharp. And 10 is death from MS, so people who've had such severe MS that they've died from really dreadful complications. And you can see that after this time, that in green is the people who have developed MS, most people have a mild to moderate disability, but there is a second peak here of people who are having much more significant problems. And these are the ones that we're especially interested, because this is what we've got to work hard to do something about, because we want people down this end, we don't want people up this end. So I'm going to move on to some of our earlier results now, and to try and, can we answer this question? Can we use MRI early on, MRI scans at the time you've got your first symptoms, or a follow-up MRI scan after 1 or 2 years, to help us know how you're going to be in the future? Now, for this part of the talk, I'm going to focus on the spinal cord. And we spend a lot of time thinking about the brain, but actually the spinal cord is a really important, involvement of the spinal cord is actually very important in people with MS. And many of the really key disabling symptoms of MS aren't referable to the brain, they're referable to the spinal cord. That's things like walking problems, spasticity, bladder and bowel problems, and pain. Those things are due to involvement of the spinal cord. Doing MRI scans on the spinal cord, though, is difficult. For an MRI, many of you will have had an MRI scan, and you'll know that you need to keep very still. And if you don't keep still, you hear someone telling you to keep still through the speaker. But there's bits of your body that can't keep still, like your heart and your lungs. and they're right beside your spinal cord. So it is tricky getting spinal cord MRIs done. It also adds extra time. We want to know what's going on in the brain because that's where a lot of the action's happening, but it doubles the amount of time that you're going to be in the MRI scanner. And that's a concern for radiologists and radiology departments because they want people in and out so they can scan as many people as they can in one day. Although there are challenges, the spinal cord MRI does show us the key things that are happening. So one of the things is lesions, and that's a little bit small actually, but you'll have to trust me that there's a lesion there in the bottom of the spinal cord. And the other thing that the MRI scan shows is atrophy. So Dr. Brownlee was telling us before about brain atrophy, this loss of nerve cells in the brain that causes the brain to shrink. We can also see that in the spinal cord. So we don't have all the follow-ups to 15 years, but we do have all the follow-ups done to 5 years. And so the results I'm going to show you now are how people looked after 5 years. And what we wanted to do is to investigate the spinal cord lesions on our MRI scan and spinal cord atrophy and how that related to disability 5 years after that very first attack. So we went back and had a look here at the MRI scans that people had when we first saw them within a few weeks of that initial attack, and then the MRI scans they had after 5 years. And these are some of the changes that we see. So on the left is the spinal cord lesion. So this was a person who came in 1997, and they had one lesion here in the spinal cord. And then when they came back in 2003, you can see that there are a number of lesions. The arrows might be easier to see than the lesions themselves. But you can also see over that time what was occurring was that the spinal cord had shrunk. So the spinal cord is about the size of a 50-cent coin, maybe the old 50-cent coins, not the ones that we've got at the moment. And you can see it sort of shrunk from a 50-cent coin size to a 20-cent coin size over that 5-year period. We also wanted to see what was happening in their brain to help us decide, well, was it what's happening in the brain that's important or what's happening in the spinal cord? And you can see here the changes on the brain scan, brain lesions and atrophy over the 5 years in that same person. So there are 121 people who had the baseline and the 5-year scan, and over that 5 years, 84 of them had developed MS, sort of similar numbers to 15 years, about 75%. But 15 of them already at 5 years were running into significant problems from their MS. They had an EDSS score of more than 3. And when we looked at those people, what we found is that they had more lesions in their spinal cord right at the beginning. So even though a lot of them had not had any spinal cord symptoms, they had lesions in their spinal cord. And they had more new lesions forming in their spinal cord over that first 5 years of follow-up, indicating that the lesions in the spinal cord may be very important. We also had a look at what was happening with spinal cord atrophy. And what we found is that the people who stayed CIS, who didn't have any more problem, their cord shrunk by 0.6%, so that's a pretty small amount. The people who developed MS but didn't have much in the way of disability, their cord shrank by minus 0.23%. But the people with MS who were disabled at 5 years, their cord had shrunk 3 times that, 7.5%. A really striking difference very early in the course of MS, just in the first 5 years after those initial symptoms. We then went on and did some pretty complicated statistics to try and understand whether it's what's going on in the brain that's important over those first 5 years, what's going on in the spinal cord is important, or it's the combination of both. And what we found was that if you just look at the brain changes in isolation, you can only predict about 1/3 of the disability. So 2/3 of the disability remains unexplained by what's going on in the brain. On the other hand, if you looked at the spinal cord MRI alone, you could explain more than half of that variability. And actually the spinal cord MRI measures seem to correlate much better with how people were after 5 years compared with the brain measures. And we think this has important implications because at the moment neurologists don't routinely do scans on the spinal cord. Even when they're making the diagnosis, they'll often just do the brain scan. It might also have implications for when we're doing our clinical trials of developing new drugs. It's nice to know that these treatments reduce the number of lesions in the brain, but it would be even better to know that they're reducing lesions in the spinal cord as well.